For safety and demonstration purposes, no actual babies were used in the production of this program. Any resemblance to your baby is purely coincidental. Health Answers for New Parents, caring for your newborn. If you need to find a specific topic quickly, bathing for instance, find the matching symbol and fast forward the tape until you see the rubber ducky in the lower right-hand portion of your screen. And now, baby's first visitors.
That baby's hungry. I know that cry. Are you sure you've got enough milk?
This little lady's got gas. I can relate to that. That goulash last night brought me to tears.
Oh, shouldn't she be sleeping on her tummy? That way, that cat can't suck the breath out of her.
Hello, I'm Dr. Robert Johnson, a practicing pediatrician in Newark, New Jersey. Working with the American Academy of Pediatrics, we've assembled a team of pediatricians to give you the answers you need.
I'm Dr. Lorraine Stern, a practicing pediatrician from Southern California. Over the next few minutes, we'll give you straight answers on areas that concern you most, from crying and colic to feeding and sleeping issues. There's a lot of good information on this tape.
It may even be overwhelming. Don't forget to use your pause button.
Consider this tape a quick reference guide, one that you can view over and over again. Parents of newborns have lots of questions about taking good care of their baby. So our pediatric team is making a house call to get you started. Please stay tuned.
The music of life.
Yes. Okay. Try making call.
Okay, now Al Green.
Okay. No. Okay. We'll go classics.
Yes.
Classics.
Okay. Lullaby and good night, 'cause you're driving us crazy.
Okay. It's Arnie Hope, honey.
Okay, here, you take the baby.
Okay. Here, come here. Come here.
And I'll get the keys, okay?
Okay, honey. Okay. Oh, wait. No. You get baby, I get keys.
Okay.
I get keys and coats. Right over here. Right over here. Okay, we're going. There you go,
Oh,
sweetie.
honey, thank you for not letting me go out naked again.
Never again, honey. That's why I'm
Okay.
here. We're going to the donut shop to get someplace done.
Every new parent goes through it. Crying and sleepless nights are part of raising a baby. And so are your feelings of frustration, stress, and fatigue. For the first few months, try to respond as quickly as possible to your baby's crying. Try gently stroking his head or patting his back. Like this, not like this. Take one side and wrap it tightly around the baby. Take the bottom and wrap it around the opposite shoulder. And finally, pull the remaining point over and wrap your baby tightly. When you're finished, you should have a baby that looks like a burrito.
You can walk him in your arms or a carrier, or securely fasten him in a car seat and go for a ride. Since rhythmic noises and vibrations can be soothing, you can try playing music softly, or even running the washing machine with a baby in a nearby room. But remember, never place your baby on or near the machine.
Even if your baby seems playful, put him right back to bed after you have fed and burped him.
I usually tell my patients they can be sure their baby has colic when they have an irresistible urge to get him his own apartment.
If colic continues, body contact and motion can help relieve your baby's pain and crying. Try walking him in a baby carrier, or lay him down, tummy down across your knees, and gently rub his back. Never shake a baby. It can cause blindness, brain damage, or death. Though colic is difficult for you and your baby, rest assured that it will pass.
Babies pick up your mood. Even if you are upset, or nervous, or angry, we must remember that babies have basic needs like comfort and feedings, but sometimes the baby simply needs to grow up.
The Scoop on Poop.
Shh, we're gonna change you now. Shh. Okay. Kathy, it's that weird color again. First it was black, and now it's green. Maybe we should call the doctor.
That can't be normal. We'd better save it for the doctor.
All right.
I'll get a jar.
Okay. Okay, we'll clean you up now. Wait, what's that?
Oh, don't worry, I cleaned it out.
All right. Just make sure you don't put it back in the refrigerator. You remember what happened with the apple juice.
Your pediatric team talks about bowel movements.
Infants' bowel movements vary depending on what they eat and their age. Immediately after birth, a baby passes meconium, a thick, dark green or black substance. After that, her stools turn yellow-green and soft. If your baby is breastfeeding, her stools will be soft and runny and look like light mustard with seed-like particles. In formula-fed babies, stools should be tan or yellow and slightly firmer, but no firmer than peanut butter.
In your infant, minor anal irritations may cause harmless blood streaks.
Formula-fed infants should have at least one movement a day. If your baby doesn't and has hard, formed stools, talk to your pediatrician about constipation. If this keeps up for more than a few days, talk to your pediatrician.
How can you tell if your baby has diarrhea? With diarrhea, the biggest concern is the possibility of dehydration. If your baby is under 3 months and has a fever, call your pediatrician right away. You should also call immediately if the diarrhea lasts for 24 hours.
Dining with baby.
It's Daddy's birthday, and guess what? We're gonna take you to his favorite restaurant. Oh, yes, we are. Honey, you ready?
Yeah, I'm ready. I'm all set.
You look great.
Thank you, so do you. Look at you.
Oh.
Yeah, okay. Here, don't worry, I got him. You go change. You go change. Mommy's gonna go change here.
I
Got him.
Okay.
Yes,
Okay, I'll be right back.
Little baby man spit up on mommy. That's okay, though. You gotta spit up every now and again. But you and I, we gotta understand it. Yeah. Honey.
Yes.
You spit up on me.
I bet that couple is making their dry cleaner very happy. Listen to your baby and let her decide when to nurse. But even if she doesn't cry, feed her every 2 to 3 hours when she first comes home. This will help reset her internal clock, which may have shifted in the hospital.
Formula-fed babies take 2 to 3 ounces every 3 to 4 hours for the first few weeks. You can pretty much follow your baby's signals.
A good way to gauge if your baby is eating enough is by checking diapers. During the first month, she should wet 6 to 8 times a day and have several daily bowel movements. Later, it's normal to have less frequent movements. There are some simple guidelines you can follow to make feeding as pleasant and effective as possible.
Each feeding should start with about 5 to 10 minutes on one breast. Burp the baby and shift to the other breast. Your infant nurses more efficiently on the first breast she uses, so alternate the one she uses first. By the end of the first month, your baby may sleep from 10 p.m. to 2 a.m.
If you're bottle feeding, you want to hold your baby semi-upright and support her head. She should not be lying down. Hold the bottle so the fluid fills the neck of the bottle and covers the nipple to prevent her from swallowing air. And if you're bottle feeding, make sure the nipple hole allows a few drops to come out. Sitting up is normal. If it becomes forceful or bloody, call your pediatrician.
Some babies fall asleep shortly after they start to eat, and many even continue to suck and eat while they're sleeping.
Baby's got the fever.
She feels warm. What do you think?
She does feel a little warm. Maybe we should take her temperature.
Good idea. Alrighty, here you go.
You mean...
You said you wanted to be more involved.
All right, sure.
And don't forget this.
Right, petroleum jelly. Okay, here we go.
No, honey, not in her mouth.
Oh, that's right. It's an anal thermometer. It's all coming back to me.
We need to turn her over. Actually, it's a rectal thermometer. Go for it.
Okay, stay still, honey. This won't hurt a bit. I hope. I can do this. I can check the oil on the car. And last week I even bowled a 204. If we know she feels warm, can't we just call the doctor?
The rectal thermometer differs from the oral one by the bulb size. You first check the mercury down to below 96 degrees. Then you rub soap and water or rubbing alcohol, like this. To clean the thermometer, you rinse it off with cool water. This is important to keep the temperature. Put a little bit of lubricant like petroleum jelly, like this, on the bulb end. Lay your baby down, stomach down, on a firm surface. A changing table or floor is good, but always be sure there is a little padding. If he is small and not screaming, you can lay him on your lap. With one hand, hold your baby's lower back to keep him still. With your other hand, insert the lubricated thermometer 1/2 to 1 inch into the anal opening. Don't push it further. Hold it there for 2 minutes. Then remove and read it.
If his temperature is over 100 degrees, it may indicate a fever. Anytime a baby 3 months or younger has a fever, you should call your pediatrician immediately.
But if your baby does get a cold, you can reduce the problems it causes. Usually, mucus blocks the nasal passages and makes it hard for the baby to breathe and suck. You can help this with a cool mist humidifier and a bulb syringe to suction the mucus. Also, talk to your pediatrician about using saline drops, especially before feeding. To suction your squirmy baby, and I know this isn't so easy, squeeze the bulb first, then put the tip gently into the nostril and slowly release the bulb. Release the bulb. Release the bulb. Release the bulb. Be sure to keep the bulb clean.
But remember, if your baby is 3 months or younger and has any fever, call your pediatrician.
Rub-a-dub-dub.
Okay, I think I got everything. I got the soap, I got the wash rag, I got my camera, and I even picked up some bubble bath.
Oh, no, just fresh, pure water. Look at these blotches.
I wouldn't call those blotches.
What would you call them then?
Rosy areas?
Whoa, the water!
All right, test it and see if it's warm enough.
Okay.
Oh, no, wait, your elbow. Remember what the book said.
Oh, I don't know. What do you think?
Oh, I can't tell. Is it warm enough? Is it too warm?
And the mother was right. Too much bathing can dry out a baby's skin. 2 to 3 baths a week for the first year is fine.
As soon as you undress your baby, put her in the tub so she doesn't get chilled. Support her head and gently guide her into the water feet first. Now when you do this, your baby will be partially above the water, so it may be necessary to rinse her often with warm water to keep her from getting too chilled. Wash her from the top down, starting with the forehead and the face and the hair. Now, as you wash the hair, it's possible to get suds into the eyes. One of the things that you can do is to cup your hands above the forehead so that you can prevent the suds from getting into the eyes. If, however, you do get suds in the eyes, just take some lukewarm water, some clear water, and rinse the eyes and get the suds out of there. Once you're all done, support the baby again, take her out of the water, use a towel, preferably one with a hood, placing the towel over the baby and wrapping the baby so the baby is once again warm. Support the baby very, very carefully and securely.
One common birthmark is a deep pink patch that usually appears on the nose, eyelids, or neck. This salmon patch or stork bite disappears within the first few months. Large bruise-like areas of green or blue on the lower back or buttocks are called Mongolian spots and usually disappear by school age.
You need to keep the umbilical cord stump clean and dry. At every diaper change, you should take a swab, dip it in rubbing alcohol, and slowly clean the umbilical cord stump. Also, fasten the diaper below the stump to keep it dry. In a few weeks, the cord will fall off. If your son has been circumcised, you'll need to keep the area as clean as possible. Be sure to gently wipe any stool off the penis with soap and water at every diaper change.
It's possible for your newborn baby to have a yellowish tinge from excess bilirubin. Now, every baby has what are commonly called soft spots on the top of her head. Here's one, and here's a second. This front one is a little larger than the one in back. These soft spots, or fontanelles, are where the bones of the skull are still growing together. Now, though you can touch these areas, you may want to be a little bit gentler.
An ounce of prevention.
Look at all these shots he needs. Diphtheria?
Pertussis.
Tetanus?
I can't stand it.
He's too little.
These needles are so big.
Aaron Coben?
He doesn't need all these shots today, does he?
Can't we wait till he's 13? Please, take me instead.
Now, Mr. Coben, something tells me you've already had your polio vaccine.
Maybe.
Okay, but we're both coming in there.
Even for the first trip home, you must have an infant car seat that meets National Highway Traffic Safety Administration or NHTSA guidelines. And it must be properly installed.
On the road with baby.
It's easy. I have a plan.
Okay, Mr. Goodwrench. I've heard your plans before.
Look, we practice on Teddy Bear. Then when it comes time to do the real thing, we're ready.
All right, as long as it looks like my sisters did when we came home from the hospital.
All right, let's see.
Ooh.
Teddy goes here, and we're locked down, and there, it's done.
Honey, it's in backwards. And I'm afraid the blood's all gonna rush to Teddy's head.
You take the necessary precautions. Riding in a car can be a relaxing and enjoyable experience for you and your baby.
People will give you advice. Remember, your pediatrician is there to help.
Being a parent of a young baby is a wonderful time for both of you. Your baby will amaze you every day with her growth and her beauty and her wonder. Enjoy this time with your growing baby. Your life will be forever changed for the better.
Being a parent can be scary. There's never been a perfect parent. But if you use your common sense and you do what feels right for you and your baby, you'll do very well.
Thanks for joining us. I trust that the information we provided will be useful to you as you embark on the journey of raising your child. Life, especially life as a parent, can be a bit intimidating. You may find that you make mistakes. You may find even that you shed a few tears. But these are the most enjoyable and important times in your life and the life of your child. So enjoy to its fullest. Goodbye.
Honey, did you hear that?
What?
Exactly. I think he's finally sleeping through the night. Good night, honey.
Good night, sweetie.
From excess bilirubin,